Welcome to Community Taking Action, ABCD's program highlighting people and organizations that are doing things in and around the Boston community. Today we'll be highlighting health services, and we are joined by Laura Donistork and Megan Hemian to really continue a conversation that we've been having about health services. Welcome to the show.
Thank you.
So what we want to do really is to just engage you guys and learn a little bit about what you do.
Well, Entre, Nosotras, Between Us program, we're on the second stage. We started our work with the community back in 2005. Basically what we do is comprehensive HIV prevention and education, domestic violence prevention throughout greater Boston area. We work with young women, 18 to 25, women of color. And it's, like I said, a bilingual program.
Is it for folks who are Spanish dominant or folks who are just comfortable speaking either language?
Comfortable speaking either language, but we understand the nature of our topics, that sometimes when, no matter how much English you know, some topics are preferred to be spoken in Spanish.
Talk about your role and what you do with the program.
I'm the program coordinator,
Of course.
and I do everything from outreach, meeting people where they are, if I have to go to the streets with flyers, with safe sex kits, talking to women. I engage them and invite them to come to our workshops going on right now in different cities of Boston. Basically do outreach, tell them what we're doing.
How often do the groups meet?
The groups meet once a week for a total of 4 weeks.
Okay.
We do pre-test and post-test and evaluation just to see if they've changed their stages of mind while being with us. And we're sponsored by SAMHSA. And just for fulfilling out the evaluation at the end of the intervention, our incentives are up to $100. Also, we do direct referrals to women to go and get tested, making emphasis in the importance of knowing your HIV status. Knowing is powerful. It gives you power to make decisions, informed decisions in your life. And also for that, we have an incentive of $10.
The family planning program, Megan.
Our family planning program is a program that is funded through Title X. And so Title X is a partnership with ABCD. It's federal money that comes through ABCD as the grantee, and we have 21 subcontracted sites with 52 service delivery sites. Within those service delivery sites, I mean, we operate out of hospitals, we operate out of school-based health centers, we operate out of outpatient adolescent departments, and we focus on men, women, and teens primarily.
It's a buzzword, family planning. When you say family planning, what do you mean by that?
Family planning is a program in which people can go to get counseling. They can go to get education in terms of their reproductive health. So they can go and get pregnancy tests. We work with pregnancy prevention. We also work if a woman is trying to get pregnant, helping her find the best methods to do that. STI testing and counseling around that, and just education in general about reproductive health.
Walk me through STI versus what I remember from the old days, which was STD. I guess the language has changed. I just want to make sure I'm current.
Well, the reason why you're going to hear STI, which is sexually transmitted infection, versus sexually transmitted disease, is because, there is a stigma towards the word disease. Infection makes it seem like it's a little bit, less stigma tied to it with the STI. But I mean, people use them interchangeably. As I mentioned, I'm the outreach specialist, so I do community education workshops, educating the community on what is family planning and how to access those services, because all of the family planning services, do operate out of primary care facilities. So they're already existing. People are already accessing the services even without me, but I'm trying to get more people to get in to kind of increase the utilization of the services because it is so important.
How invaluable is teamwork, and how do you make that work, whether you're sitting next to one another or not, as we wrap up?
Well, I'm going to say that email is wonderful, and most of us have work phones, and we also do regular check-in with our supervisors, so we can all be in the same page, even though sometimes we don't see each other for a whole week. Just at the workshop site or at certain events, because we do cover community events like community health fairs, different national day events where we celebrate National Testing Week, National Hepatitis. It was like 2 months ago. So we, even though we're not working together, we meet a lot.
And if there's one phone number, as we wrap up, for someone to contact you guys, what would that one number be?
My phone number is 617-348-6519, and I'm the program coordinator that speaks Spanish, so I can take calls in both languages.
And people can also reach out through the ABCD website and the ABCD phone numbers as well
Yes.
and reach you
Yeah.
guys.
Yeah, definitely. I mean, if anybody wants a list of all of the comprehensive community health centers, they're all listed on the ABCD website under the Health Services Family Planning tab.
Family planning.
Definitely,
Wonderful.
yeah.
Well, I thank you both for coming. We are at a close for our program. We thank you for joining us on Community Taking Action. Tune in with us next time as we highlight more programs, more people, more organizations that are doing things in and around Boston for the community. Until next time.